So I think you'll see continuous care be accepted as the go-to model for chronic disease, and you'll see integrated virtual primary and chronic care. And I think you'll even see virtual first, where there'll be different plans where you sign up for a virtual first plan and you interact virtually and then decide if you go see a physician.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Stephanie Tilenius, founder and CEO of Vida Health, a licensed virtual medical care platform with therapists, coaches, and nutritionists operating in all 50 states. Vida allows consumers with multiple diagnoses to receive care uniquely suited to their needs by addressing a range of medical conditions rather than singling any one condition out. Before she launched Vida Health, Stephanie ran consumer experience platform in big-name companies like Google, eBay, and PayPal. In this episode, we talk about how Vida got its start, the importance of addressing mental and physical health together, and the future of virtual medicine. Here's our conversation. Well, welcome, Stephanie. Thanks for joining us today while you're on your vacation.
It's great to be here. I'm sitting in Tahoe and looking out on the beautiful pine trees.
Oh, that's nice. Yeah, I'm glad summer is here and things are opening up. I thought before we start, maybe you can share with us a little bit about your personal background and what get you excited to be in healthcare, and who inspired you and what inspired you.
Sure. Well, my personal background is mostly in technology, and really I had a personal situation with my father who had multiple chronic conditions that led me to start Vida. So I spent my career in tech. I was at eBay and PayPal for nearly a decade, and then I was at Google, and I built products that scaled to millions of users, mostly in commerce and payments. And payments is kind of regulated similar to healthcare, so a lot of experience building systems there. And, my father had multiple chronic conditions, probably not unlike the rest of the U.S. There's at least nearly 150 million people that have chronic diseases. So he had diabetes and obesity, and they're interconnected, and CHF, COPD, and depression. And I was really trying to find like a mobile solution for him where I could see his stats on a daily basis. I could understand what was going on. There was, a day-to-day accountability from a human, like a coach, who could help him with his nutrition, his stress, his sleep, and all the underlying root drivers that were, inflaming, making things worse for his chronic conditions. And then obviously medication adherence and other things. And there really wasn't a solution. And I just started prototyping and I realized that the intersection of the mind and the body was just so important to tackle. And you really had to bring something to market that was like what my father needed, which is something all in one place. And, my father wouldn't have wanted 5 apps and, he could wear 1 or 2 devices, but he wasn't going to use everything. And he really needed a human to keep him accountable. So really that's how Vida came to be. And now we just, we're scaling and serving large employers and payers.
I assume that he has this condition later in his life, or is it something that's when you're growing up that you experienced this?
No, it was more. It was more later in his life. Although he'd had it for a while, but then all of it got much worse. So the diabetes, started to affect his feet, and the CHF and COPD came later. I think we probably miss the depression. I think mental health is now taking front stage, and people are really understanding how many people in the U.S. are really suffering, even from subclinical or mild to moderate mental health. And his was moderate, but it does impact your physical health. And I think we all underestimate the impact of mental health. So we didn't really know about it until late.
Mm-hmm. So it's interesting because I think, I'm just going to way back in your time, you work a lot in a technology company in eBay and then Google and doing a lot of the payment stuff. But you also had experience starting a company during the .com boom. And tell us more about that and how that experience helped shape who you are, like in terms of when you started Vida, what informed you from that?
That is true. I did start a company and took it public in the late 90s, so I'm definitely dating myself. It was an online pharmacy. In fact, many of the ideas still were in my mind when I started Vida, because at that time I tried to have an integrated pharmacy with disease management, and so many of the ideas still were percolating. And mobile obviously didn't exist at that time, and the technology for machine learning had advanced, so there was a lot more possible starting Vida than there was when I started Planet RX. And the other big difference is just the technology evolution. So all the cloud-based services make it so much easier to be an entrepreneur and to connect different systems and to get started with an MVP where you can really test the product market fit. So it's a completely different experience starting a company now versus the .com.
But it's interesting, even with that time, you were successfully, brought that company into public, and that obviously a lot of things happened during that time. What are, from everything that doesn't work, what works, that, what do you bring when you started Vida? What kind of stay in your mind, like make sure that you don't, the lesson that you learned then is applied to what you're doing now, even though with the different technology?
It's really funny that you asked that question, because we're all a product of our experience, right?
Mm-hmm.
And I think my combined experience of being an entrepreneur early and then being in big companies and launching products to millions of users and scaling all kind of come together, because I worked at companies where we ran, like at eBay and PayPal, we had large marketplaces of users. So you had supply and demand issues. You had to understand regulatory constraints and how to build products that delighted consumers, but also met the needs of a regulated market. So a lot of the learning I had throughout my career, and also just building products that delight users and knowing how to do that, came to fruition when thinking about building Vida. And I really was bringing together my passion and interest in healthcare, but more importantly, my experience in building products. And then when I was at PayPal, I ran a large B2B business. And so I had the experience of working at least in the payments industry in B2B and selling in that environment. So it's all kind of a culmination of a lot of different experiences that come together, because healthcare is complicated. It is B2B2C largely business. And so all the learnings along the way have helped. And the fact that I've been able to take the learnings I've had in big companies where I worked with, large scale teams and took things to market and scaled them. I think that's really important, because in healthcare, we need a lot of scale. We just, we're not changing the industry fast enough. So I can bring all the tech experience, but also understand how to live in a regulated environment.
Yeah, it's interesting when you talk, when you talk to a lot of people. It's funny how all your past experience seems like it's designed to do what you're doing right now, but it's just give you the like now when you look back, it just the dots all connected. It's like, oh yeah, I do this now. It helped me to do the thing that you're doing right now. So I think that it's very relatable to I guess when you're young, you don't think about that. As you get older,
yeah, you don't know that you're connecting all the dots until you get there later in life.
Yeah. It's like, hey, it looks like I planned all this journey so that I can do this X, Y, Z.
That's not true, and life is not a straight line. So, I wish my kids would understand that.
Yeah, I know. So I mean, maybe this is a good segue for our listeners to hear more about what is Vida, what is Vida is trying to do, how does it work?
So Vida is a virtual care company that is providing physical and mental health virtual. So it is, we are a medical provider in 50 states, and we combine the human touch and telemedicine virtual care inside the app with digital therapeutic interventions for different chronic conditions, both physical and mental. And then we connect to devices. We ship devices to your home, and we do remote patient monitoring. So we're bringing everything together in one place, and we're using machine learning to really personalize the experience and meet the person where they're at. So the idea is that we are taking a holistic approach to your health, and we're providing the right care to the right person at the right time. And we're generally serving people who are been living with chronic disease, and they want to manage it better so they can live a better life. And they tend to have, the average user at Vida has 3.3 conditions. So there's a lot of overlap between diabetes, hypertension, hyperlipidemia, anxiety, depression. So we cover a range of conditions, and we provide multiple. It's an integrated care team model. So we provide multiple. If you might be enrolled in a diabetes management program and a CBT, cognitive behavioral therapy for depression at the same time, and have a therapist and a diabetes educator helping you.
It's almost like you're serving a lot of the patient population that is really hard to manage.
We are serving individuals that are more expensive and have comorbidity, living with comorbidities from different chronic conditions.
Yeah. No, I like your approach, like looking at it as a whole person. And I think, can you tell us more about, I mean, we've seen study that, a lot of this mental health and affecting people with the cost of care for a patient with a chronic care, when you layer them with the mental health, it can be double, right?
Yeah, it's really important. I mean, if you look at the statistics, individuals who are living with diabetes and depression are 4 to 6 times more expensive. Mm-hmm. And I mean, you really have to treat the mind and the body together, regardless of severity. I think we have to take a holistic approach, universally in our country. And I think that people are recognizing how important mental health is now. And sometimes mental health, challenges actually cause physical health problems, and vice versa. So when we first started, we started with cardiometabolic syndrome, effectively diabetes and weight loss. Within the first year, it was very obvious. Our coaches would say they couldn't treat the diabetes without treating the depression, and they're really interconnected. And I think we underestimate how much that is the case. And we've seen outcomes where, when we treat the mind and the body together, we get better outcomes in terms of reduction in A1C, and which is the measure for diabetes, or PHQ, which is a measure for depression.
So can you walk us back to the beginning of your start of Vida? I mean, right now, when you look at the Vida offering, it seems so comprehensive. I imagine when you first start, it was not all comprehensive. How do you build that, and how do you, grow it to cover more and more areas?
Well, we first started with diabetes and weight loss, what I would call cardiometabolic syndrome, and then we layered in cognitive behavioral therapy. And then we've layered in, hypertension, and so we have a program for congestive heart failure and COPD and asthma. So we've continued to add. And so the nice thing about our platform is that it's built in a very scalable way, leveraging in some of my experience. And then we've hired a lot of other people on our team out of both healthcare and tech who have scaled large platforms. And so it's, once you've built the infrastructure, it's much easier to add on, and an additional area. You can hire the clinical expertise, and then we really pride ourselves on taking a very strong cross-functional approach. We would bring clinicians and then product folks, and and care providers, and medical experts in various areas, as well as researchers and engineers, everyone together to build these clinical areas. So, but we built the platform and enabled us to, that enabled us to build these different areas. So we really started early with diabetes and weight loss, then expanded into therapy, then added all the other programs. And we spent a lot of time recently really honing that integrated care model. And knowing how to personalize the experience using data and machine learning to continue to improve the intervention and the what we call the closed loops inside the app, where you see how people are either talking to their coach or their therapist, and then activities and tools and trackers and things they're doing, their data that they're sharing from their devices, either claims or RX data. And we're looking at all these things and looking at patterns, and then using machine learning to continue to personalize and improve the product.
It's like, based on what you're saying, it's not more like you're building it to grow. I've seen a lot of, conversation I hear about, like, entrepreneur who just started. When they just started, they probably have, one focus area, and then investor always say, well, their question always came from the investor usually. Well, so and so can just copy what you're doing and include it in their platform, or say Livongo can just put it into their platform. And what do you recommend, or what advice do you give? Can you give to entrepreneurs how to address that? Because like anybody, even like Vida or other company that become big, they also started one or two areas and then they build it out, right?
Mm-hmm. I think you have to pick a problem that you're trying to solve. You really anchor in the customer and what solution you're trying to bring to them, and whether that is unique and necessary in the market. So you're seeing new companies in digital health come up that are tackling more nuanced areas right now, like digestive health or substance use disorder, or you're starting to see, or kids psychiatric or behavioral health care. So you're starting to see a lot more players go deep in specific areas, and I think you just have to pick the right problem you're trying to solve and really truly solve it and go deep in the customer solution.
And then from there, that's when you can just grow it to do something.
Yeah, you have to have your first customer, and then your next 10 customers, and then 100, and then 1,000. You have to really delight each one of those customers and learn from them, and then apply it to apply the learnings to continue to scale. But if you don't get the first 100 and the first 1,000, and you have to iterate fast. So.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So you mentioned that, being in Google and eBay, being in eBay, you learned a lot about how to delight your customer. What are the key areas that people need to think about in order to delight their customer?
That's a great question. Well, so we use Net Promoter Score to measure that, and we have a 76 NPS, but we didn't always have a 76. It was, in the 60s, and then we've continued to improve. So it's really about not only a great user experience from a product perspective, but it's actually solving the pain point for them. And so many times when you're a startup, you don't have to have the perfect app right away. You might have the perfect end-to-end experience. And you might use a lot of even manual back-end manual solutions to make sure you're delivering to the customer and testing if that solves the problem for them. And then you can come back and build technology against it. So it's a bit counterintuitive, but you have to solve the problem end to end and make sure that that end to end solution for the customer really works and delights them, and figure out what components of the product should be automated. But sometimes you can't automate until you've actually served the customer end to end and done a lot of things manually first. And, I've seen a lot of startups use spreadsheets and do different, it feels like duct tape. But in many ways, it's a smart thing to do because you learn fast and then you figure out what to build and scale. So you have to have a core tenet of the problem you're trying to solve and how you solve it, and have that part of the experience be amazing. But you don't have to have every part of it automated or perfect.
It's kind of like you start with the basic. You don't need to go fancy pretty quickly.
Yeah, you have to start, like, I think Reid Hoffman's famous for saying, if your first product, your minimal viable, MVP, there's minimal or maximal viable. It depends on how you define it, but if your first product is not embarrassing, then you're not doing it fast enough.
That's a funny one. If it's your first product not embarrassing, it's so funny because everybody wants to impress, right? And I think sometimes they forgot to solve the basic problem because they try so hard to impress.
Right, like some mobile apps will use web-based frameworks or React and build something very quickly just to see if it delights the customer. And then they will go back and build, a much more sophisticated native app. And that's generally pretty smart to do.
Yeah, it's interesting because I think oftentimes, as a human reaction, I feel that if it's so simple, then you feel like everybody can solve it. Everybody can do it. But to make things simple, actually, it takes a lot of thinking and understanding.
And iteration.
Yeah. And it seems so, feel like the more education you get, feel like the more complicated it is.
Simplicity is definitely underrated. Simplicity is really important. It's totally underrated.
Yeah. So that brings me to my next question. It's like in delighting the customer, how do you make your program sticky to your members? Why, for them to keep engaging and continue using your program?
Well, we measure all this. We spend a lot of time looking at all their activity in the app. So we have the majority of our users use the app on a daily basis and do multiple things per day. So for me, it's when I was at Google, Larry Page used to talk about the toothbrush test, and he wanted to build products that people used at least twice a day. And of course, Google is like that. And I always said that in healthcare, I wanted to build something that was built into people's, daily lives. And I think we've done that. And so we measure all the things they do how often they talk to their provider, their coach, or their therapist, how often they're using completing lessons or participating in a group or using tools inside the app or sharing data. So we measure all of that, and we look at retention over time and activity over time and patterns. And we're constantly developing, and improving the solution, but developing closed loop behaviors where we can see if somebody does something, then if the coach responds this way, then it'll actually improve their outcomes. And so we connect the consumer product experience with the provider product experience and make sure that we're also enabling our providers to use technology to be helping the consumers succeed. So we connect the dots between both of them. And it takes a lot of iteration, and you have to really measure what people are doing on a daily basis and constantly improve.
Yeah, and it's interesting, like what you're mentioning about Vida is also a provider, right? In the old healthcare days, when they talk about providers, always like the doctor, the hospital, and not in a virtual world. And how do you see, the pandemic definitely make people become more comfortable, but in a virtual healthcare setting, how do you think the industry will change, and how the consumer view healthcare differently?
Sure. So, well, first of all, I think the silver lining of COVID was that more and more people were exposed to telemedicine, and they're very comfortable with it. And you're going to just see it escalate from here in terms of, I think there's been a little bit of a boomerang. People are going back to see the doctor in person, but the things that we do for chronic disease and therapy typically are staying virtual. And what I see in the future is that we're creating a healthcare system where we allow all the providers to practice at the top of their license. So physicians practice at the top of their license, and then therapists, coaches, nurses, everyone practices at the top of their license, and it's an integrated care team model. And then you use machine learning and AI and bots to do the low-level tasks to make everyone else, more efficient with their time. And that way we can scale more people, more providers, and also provide, access and more care, because we do have a gap in access in the country. And you really don't need. We work with physicians where they're so excited when their patients come back and they've been working with Vida, and the physician will see an A1C drop and improvements in hypertension and weight loss, and they'll be like, "This is great, congratulations!" And the physicians don't have the time to to do that, and they are really appreciative of the work that we're doing. And so we're a continuous care model in between the physician visits, and it makes the whole system more efficient. So I think you'll see continuous care be accepted as the go-to model for chronic disease, and you'll see integrated virtual primary and chronic care. And I think you'll even see virtual first, where there'll be different plans where you sign up for a virtual first plan and you interact virtually, and then decide if you go see a physician, and if it's severe enough where you actually have to go in person.
So does Vida also work with the brick and mortar kind of health providers?
We do. We integrate with existing brick and mortar physicians, and we will definitely, if we have a patient that is living with diabetes and comorbidities and they're on insulin and we can take them off their meds, we will have a Vida pharmacist or coach reach out to the PCP and to adjust their meds.
Okay, cool. So with providing a lot of the virtual care, how is Vida as a company going back post-pandemic? Is everything back to in person, or?
Oh, that's a great question. We're still virtual. We'll be going back into the office in September.
Okay, yeah. So it's so funny how everybody's grappling with that right now. So I don't want to keep you for too long, especially on your vacation. Can you share with us 3 lessons learned from your experience that you can share with our entrepreneurs? What are the 3 important lessons that you learned that you keep in your mind?
This is for all healthcare entrepreneurs,
Yes.
right?
Yeah.
So one is solve the problem holistically and delight the customer. And 2 is, I would say, in healthcare, you need to figure out the payment model and understand whether it should be a direct to consumer or through a B2B to C model, and know who the payer is essentially and what the incentives are. And then the last lesson would be unit economics. Make sure you really understand how you can create a strong business going forward with positive, gross margin and contribution margin, and just, how you can scale a meaningful business with great economics. Because sometimes that trips people up.
Yeah, I think healthcare is complicated about who gives the care and who pay are different people. Okay, well, thank you so much for your time and your insight.
Thank you for taking the time to interview me. I really appreciate it.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, our content writer, Kelly Muscat, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.